Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life. My co-host Daphne, the unconventional dietitian, is always ready to shake things up and bring a fresh perspective to your wellness journey. And we can't forget Dustin, our producer, who keeps everything running smoothly behind the scenes. Together, we'll chat with health and wellness experts along with everyday people who have inspiring stories and practical insights to share. If you're ready to nourish your body, move better, and discover simple ways to thrive, you're in the right place. And hey, if you enjoyed today's conversation, don't forget to leave us a comment sharing your thoughts, and subscribe so you never miss an episode. Welcome back to another episode of Living Vividly. Today we're joined by Dr. Betsy Goggan, one of the first naturopaths in Lafayette, so we can't wait to get into this conversation with you.
Great. Thank you for having me. This is great.
What is naturopathic medicine?
And give us like a brief overview of how that is different from obviously like just traditional medicine versus
allopathic medicine. Yes.
Osteopathy and chiropractic medicine. I mean, these are all different paths of medicine.
Naturopathy is looking at the underlying cause of a situation instead of masking it with prescription drugs or supplements or vitamins, but actually looking for what's causing the problem to begin with. So that's kind of the basis of where naturopathic medicine starts, is to look at that underlying reason.
So it sounds like that was like the godfather of what we now call functional medicine.
Yes. Okay. Yeah, exactly.
Functional medicine is all defined as kind of looking at the root cause. So, but naturopathic medicine's been around for a lot longer.
Yes. Yeah, exactly.
How did you get into this line of work?
I, in my previous life, I was in the corporate world. I was a hiring center administrator for Xerox Corporation in Houston. And it was a rewarding job, and I loved it, but there was something missing. It was just, it wasn't my passion in life. And so as I, moved along through that career, I started experiencing things like massage and Reiki and different modalities in the holistic field. And that really sparked an interest for me. And so I started looking into that area, and I ended up going to studying for my naturopath degree. I studied with Dr. Charles McWilliams in Nevis, West Indies, and then I apprenticed with Dr. Marika von Vixay in Asheville, North Carolina. And that was the start of this whole journey for me 35 years ago.
Wow, that's quite a drastic contrast to being a Xerox corporate person.
Yeah.
And I'm sure a lot has changed in 35 years from when you first got into it to now.
Yeah.
I feel like it's almost getting a rebrand, or it's coming back.
It's The nice thing about the beginning of my career was in Lafayette, and it was it has always been very holistic here, very open to natural medicine. I think because of traiteurs and the history of of all of that has just been very open and accepting of all of this.
That's so interesting that you think that, because that is not the world that I see. I mean,
really?
I think I feel like we are. Maybe it's just my. I don't know. South Louisiana is always, I feel like, the last to be on the cutting edge of anything. Like we hear things like Asheville. I would expect there to be naturopathic medicine in Asheville decades and decades ago. Yes. But here I wouldn't see it that way. But you're right. My mother-in-law is 84 and from Arnaville, and she took her kids to traiteurs, and that was like part of their growing up, where I'm not from here, so that was not something that I was aware of. But it's interesting to hear you say that, because I would have not thought that at all.
Yeah, I feel like we do have some sort of connection to something deeper within, and I can see both, because you're in diet and nutrition, and that's not something that Louisiana really likes. But I do see maybe anything besides eating healthy could be
very open to, Reiki and energy work and those kinds of things years ago. That was always intriguing to me because I would go other places, and I'm from Texas. And as you can tell by the accent, people were never, even in the bigger cities, Austin and Houston, and people were not as into holistic as they seem to be here. I've lived in Florida, same thing there. There's just not the draw to it, but it has always been very open and accepting here for me. Mm-hmm. And the kinds of work that I do, people were very interested in it, and they would still go to their doctors, but they would come to me for, kind of
a supplemental.
Yeah. Kind of. Yeah.
So why would someone go to you in addition? Like, what are some issues that they would go to you for?
Cholesterol problems, arthritis, fibromyalgia, cancers, different kinds of cancer, hepatitis. I've had people that would go have their treatments for hepatitis, and then they come to me and have a lymphatic session to kind of help get rid of the excess toxins that were being in cancer as well. They have chemotherapy and then come have a lymphatic session to kind of clear out some of the excess toxins that were being put in their bodies. And it seems to give people a better quality of life as they're going through those kinds of, treatments that are kind of harsh.
So aside from lymphatic, which we'll circle back around to, what other types of treatment modalities do you have?
I do a hair mineral analysis, testing the minerals in the body, and it's a very concise diagnostic tool for people. It will tell a lot about what's going on in your body, and you can kind of pinpoint maybe not a disease per se, but you can see where different minerals might be out of whack, either too much or not enough. That could lead to something later on down the line. So I call it kind of a wake-up call. It's about a 12-page report, and it goes through dietary suggestions, and it cuts out the crapshoot at the health food store. So you're not going into the health food store, reading about something and saying, oh, well, that's, I need one of these and I need one of those. And before you know it, you have a kitchen counter full of all kinds of supplements.
Like my supplement cabinet.
You don't need.
Yeah. I had a lady one time, she came in with a copy paper box full of supplements. She wasn't taking all of them, but she, different practitioners had given her different things, and she just ended up with this huge box of supplements.
So, that can be as detrimental to your system as prescription drugs. You're
over-supplementing.
You're taxing your liver when you're taking all of those kinds of things, and then you're sluggish and you don't have any energy and you don't know why. And so that's the first thing that I do, and I'm sure you do too, is say, let's put these off to the side for a little while and give your body a rest. And
it sounds like it gives you a good way to look at a process, just like the way that the systems process things. So I'm always very hesitant in my field, in my world, to say anything is diagnostic, because I can't really diagnose anything. But we can look at bigger pictures and look at a process and a way a process is working, and compare that to how the system is supposed to work, and then remove the barriers at that point.
Yeah, exactly.
So let's talk about the lymph system.
Okay.
We hear so much about all of our other systems, like the cardiovascular system and the digestive system and the reproductive health system, but we don't hear a whole lot about the lymph system, although it's very, very important, primarily for detoxification. So tell us about just kind of general overview of the lymph system.
The lymph system? Well, first of all, we have about 600 lymph nodes in our bodies. We have the lymphatic vessels that the fluid runs through. Lymphatics run head to toe. We have drainage terminals in our bodies that all of the toxins drain into. And what happens is the lymphatic system is like the filtration system for the body. And so when that filtration system gets clogged with toxins, because that's the job, is it's moving through and picking up toxins through the body. So as those toxins calcify or crystallize, they block the drainage terminals in the lymph system, and the lymphatic fluid can't flow properly. And that's what sets us up for lymphedema and inflammation and sluggishness and brain fog and all of those kinds of things, headaches and et cetera, et cetera. The process that I do is using light emission therapy. It's using a machine called a light beam generator or a low frequency laser. And it's using a photon light that is either argon or neon, that when it makes contact with the skin, it liquefies the toxins in the lymph system so they can flow and drain again, and then eventually go through your waist and out of your body. And it gives you more stamina, more energy. You feel better. You sleep better. People generally kind of lose that urge for the junk food and things like that. They tell me after a session, I'm more mindful of what I'm eating now. I'm more aware of what I'm putting into my body. I just overall feel better. They lose some weight. It's fluid, but nonetheless, they'll wake up the next day and maybe be 5 pounds less.
Yeah.
And then that encourages them to be more mindful of what they're eating and things like that.
So where does the lymphatic fluid come from?
Well, a lot of it comes from your blood.
Yeah,
from blood, yes.
Because whenever your blood's going through your veins or
kind of
any other fluids, like it exits your vein,
the
goes into your cells, and then...
Before we get too far away from it, what is the body's natural way of cleaning those filters
versus the light therapy?
Versus the light and all of that. If you can use like a loofah sponge in the shower and just, lightly scrub your skin.
So even before that though, like, is your body supposed to be, like, without you messing with it, is it supposed to naturally?
It should naturally, but this is the issue. We have so many chemicals and toxins in the air that we breathe and the water that we drink and the food that we eat. In the United States alone, we have an average of about 400 new chemicals released into the environment every year. And so that goes into the soil that's in the food that's grown in the ground. Again, it's, the water that we drink and the air that we breathe, and you're constantly putting toxins into your system. And
so it makes it hard to naturally lose them.
Where we used to, 50 years ago, it was a totally different story.
Right.
Air was a lot cleaner and everything was a lot cleaner than it is now.
So we're just overloading our bodies.
We're overloading
our
bodies.
Detox.
Yeah.
Well, I think another side of it too, my understanding is that the lymph system gets pushed through. It doesn't, like your cardiovascular system has your heart that pumps to push things through, where the lymph system doesn't have a pump. So it has to be pushed through using movement, right? I mean, whenever your muscles move, it kind of encourages that lymph system, the fluid to move through your system. Yeah. In addition to being overloaded with toxins, we're also sedentary and not moving in the way that we used to. So we can't flush it, or we're not that we can't, but we're not flushing it out as efficiently as we used to.
Exactly.
And then also you have to be well hydrated to be able to have fluid. We've talked about this before.
Nobody's well hydrated.
So if you're not drinking enough and you're not moving enough and you're overloaded with toxins, it would be pretty easy for those little valves and those lymph nodes to get overwhelmed.
Yeah. So the general rule is for water drinking is that you should drink half your body weight in ounces of water a day.
Right.
So if you weigh 100 pounds, you would want to drink 50 ounces of water a day. And that's a good way to flush your system, keep your liver cleansed and gallbladder and kidneys and
I usually modify that just a little bit and say half of your desired body weight, because for some people who have a lot of excessive weight, like for a 300-pound person, we're really don't need to hydrate all 300 pounds of that. I mean? So if we can get to like 100, like if your goal weight would be 200 pounds, even though you currently weigh 300 pounds, we want to get to 100 ounces of fluid.
That's good. Yeah.
So, and that's a lot for some people.
I'm sure most people don't drink what they're supposed to be. I mean, I used to own a vitamin infusion clinic and everyone's dehydrated.
Right.
Just.
Right.
It's part of it. We drink so much coffee and so much soda. And
that's what I'm saying. Coffee doesn't count as water, Jackie.
I know. Yeah. I'm trying to make it happen. Add a little water to my coffee. An Americano. It's hydrating. Actually, one of the major things that the nurses would do whenever assessing someone if they can get an IV was check their ankles for swelling.
Exactly.
I never really understood what they were doing at first. Like, what do your ankles have to do with an IV? And I realized.
Well, part of the lymphatic system is the tops of your feet are one of the most congested areas of lymphatic vessels in the body. It's called the Sea of Lymph. And that's why you do check ankles, and because it's so easy to have edema in your ankles because of that. If your lymphatic system is clogged, one of the things it's going to affect is your ankles because of all of those vessels in the tops of your feet.
And does gravity have something to do with that? Because the vessels are at the bottom. So
that would make sense, especially since there's no pump in the system.
So they just get stuck down there.
Yeah, so the things that you can do on your own are like swimming is a good way of moving your lymphatic system.
So I got to get a pool.
You got to get a pool. Yeah.
Shucks.
Got to get a pool.
I'll work on it.
Dang. A mini trampoline. If you jump on a mini trampoline.
That's all the rage right now on social media. The little reformer.
Yeah.
Do they call it a reformer trampoline? I really want one.
The loofah pad, like I was talking about a while ago, or those little net things in the shower. Just do a rotating.
The dry brush. I have one of those. Yeah. I always thought it was to exfoliate my leg hair. So, what do you think about the gua sha thing?
I'm not that well versed in that, so I really can't say. I think it's fine, and I know a lot of people that use those and like them.
So is that the face lighted mask?
No, it's a little stone.
It's the stone.
Oh, okay.
It's like jade or
I actually have one of those.
Quartz, pink quartz. Yeah.
I was saying literally like 2 days ago, I saw a video talking about that. And when she said the word, I was like, that's the word. And it was like, you don't have to use one of these stones. Just use your hands or...
Yeah, you could just use your fingers.
And that's kind of what you're saying. You can kind of use whatever you have.
Whatever you have. And
So is the pressure important? Like, do you need a lot of pressure when you do it?
No, actually, the lymphatic system is very delicate. So you want a real light touch pressure.
So it's not like a deep tissue thing.
When you don't do deep tissue for the lymphatic. Yeah, they're little tiny vessels right underneath the skin surface. So you want to be real gentle with them. And a manual lymphatic massage should be very easy and gentle, not any pressure or anything like that.
What are some things that, let's just say your lymph system is completely clogged up, you're not doing anything to support it. What are some consequences of that besides swelling?
It affects the central nervous system. It can cause, when your lymphatics are clogged and your body is toxic, the lymphatic system supports the central nervous system, and so it can cause any kind of neurological issues that might be, everything from dementia, Alzheimer's, Parkinson's. Different things like that. So, and then the chemicals that we're ingesting on a daily basis, people, aspartame is a big one for me.
I've been waiting to talk about aspartame.
Oh my God.
Don't even get started.
It hurts your heart.
Yes, it does. It like makes my heart sink whenever somebody says that they're drinking aspartame.
Yeah. Diet Cokes and chewing gum.
Crystal Light. Yeah.
So, yeah. Just to watch those kinds of things and cut that kind of stuff out, that will give your lymphatic system a better chance of doing, its job and staying cleaner. And doing things like lymphatic massage, either manual lymphatic massage or doing something like what I do with the machine that will cut to the chase quicker. My mentor, Dr. Marika, is a European medical doctor, and she studied with Dr. Vader way back years and years ago. He was the one that he was in Austria. He was the one that kind of discovered the lymphatic system and the importance of the lymphatic system.
Oh, wow.
And so she knew him and worked with him. And when she came to the States, her thoughts were that there has to be something quicker than manual lymphatic massage. There's got to be something that could cut to the chase faster. And she started studying photon light and discovered that that was what would make the toxins liquefy and get out of your system quicker. So she kind of was the pioneer of this light emission
Did she
therapy.
create the machine?
Yes,
That's
she
incredible.
did. Yeah. So I was fortunate enough to apprentice with her way back in the day, and
Wow.
she's still around. She's in her 90s now, but she's still very much
A testament.
involved. Yeah,
Does
exactly.
natural sunlight have anything to do with it too? Or is it just that concentrated?
It would be the bulb, the photon light
Mhm.
bulb that
Okay.
would be, because it's making contact with the skin,
Okay.
you know, so it's right on the skin. I mean, sunlight is good for all kinds of things,
Mhm.
but this would be something that, as it makes contact with the skin, it also produces ozone. The machine that I have produces ozone, so it's an antibacterial.
Mhm.
And so as soon as it hits the skin, you can smell the ozone in the machine, and it's killing bacteria on the skin as well as liquefying the toxins in the lymphatic system.
I've heard so many cool things about ozone. Can't you do it IV? I mean, I know you don't,
Mhm.
but
Yeah,
I've heard of
it can be done.
doctors doing
Yeah.
it through
Mhm.
IV. And
Mhm. There's a doctor in New Orleans that's very well versed in that, as well as other things. But yeah, he's very well versed in ozone therapy.
there's so many crazy
Interesting.
modalities
Yeah.
that are
Mhm.
coming out.
Mhm.
The only reason I was asking about the daylight is because we just started reading a book called Light, The Future of Medicine. And
Mhm.
it's an old book,
Mhm.
but it's all about how light affects our health. and-
Exactly. Yeah. Exactly.
So aside from the central nervous system
Mhm.
symptoms, what other kind of symptoms can we get from an overclogged
An overclogged
lymph?
edema, brain fog, fibromyalgia symptoms.
Okay. So that would be like
joint
pain
aches
in
and
your
pains.
joints and muscles?
joints, and it really kind of affects anything head to toe. And you know,
Just
you
a
could have
wide range of symptoms.
Yeah, and I'm sure you find this too. You know, it's hard for people to change their diet, change their lifestyle, and all of that. And you can give them, you know, watch salicylates, you know, watch maltodextrin, you know, keep the aspartame out of your diet and all this stuff. And there's always some excuse why, you know, oh, well, blah, blah,
Right.
blah. But
Change is
they
hard.
continue to have the headaches or the migraines or
Mhm.
whatever. And it's like, please, you know,
you gotta
just look at this.
Find
Give
your
it,
triggers.
give it a month and just try it. And so, yeah.
It's still funny. The more I hear about aspartame, the more what you said, I think the first time we talked about it, of why is it still legal, keeps coming to mind. Like all the things it does. It's like,
One day we'll have to talk about how it got into the FDA.
yes.
Yeah. And in the first 6 months that aspartame was introduced into soft drinks, brain cancers went up 10% in the first 6 months of using aspartame in soft drinks.
Wow.
And it's been it crosses the brain, the blood-brain barrier,
Mhm.
and causes all kinds of central nervous system and neurological problems.
Parkinson's disease. It's been
Parkinson's
linked
disease.
to Gulf War
My
syndrome.
mother had Parkinson's. She drank Diet Coke every day. And that was another thing, you know, that I'd talk to her about, please leave that alone. Well, the doctor said, you know,
Yeah.
and she was in that age group and mindset, and, you know, he's the doctor, and he says it's okay.
Authority. That's
So-
devastating.
It's one of those things, like if you grew up on that, like, is it too late? Am I in trouble? What's going to happen?
I don't think it's ever too late.
Yeah.
You better start jumping on a rebounder, though.
Yeah. Okay.
Yeah.
I mean, when that foot gets better.
Yeah, once I can jump.
Well, your cells renew quite quickly.
Yeah.
And if you,
If you haven't gotten it yet, you still have a chance.
I think there's
Yeah.
actually, I'm making it up, but I'm pretty sure I read a study that it was like a 6 or 7 days of not consuming glyphosate. It's out of your system. So our bodies do the detox. Like they, if they're functioning correctly, they detox.
Right. A lot of people have knee problems. They have knee issues. And a lot of times it'll be swelling around the knees, and it's lymphatic. And they'll come in and I'll do a session on them and work, you know, specifically on their knees. And boom,
Really?
the edema's gone, and they wake up the next day and their knees aren't hurting, and things like that.
I must have sent my grandpa to you.
I have all sorts of relatives that are having some knee problems.
So that happens with one light session? Wow.
It's amazing what this.
I've gotten it done.
It's amazing what it.
And I could tell the difference
Could you-
just after that one. I just felt lighter.
Yeah, that's
And,
what people people always say I feel lighter, I feel more energetic, I have more stamina through the day. It's good for people that are healthy, that want to stay healthy, and it's good for people that have any kind of physical ailments or issues or whatever, to just kind of start cleaning it up a little bit at a time, and eventually they're in a lot better shape.
For the purpose of supporting our lymphatic system, we need to make sure that we're well hydrated.
Right.
Half of your body weight in ounces of hydrating fluids is what I usually say, which does not include coffee or alcohol. Yeah. So we need to be well hydrated. We need to be moving, perhaps like bouncing. So the rebounder, I've heard jump roping, running can also gives you that little bounce. So we need to be moving. We need to be not putting extra toxins in our system. And if you want to top all of that off, the light system or the light detox that you're describing helps to just kind of move things through. How often would you say that it would be recommended for someone who doesn't have known issues?
I usually recommend that people do it about once a month to every 6 weeks.
Okay.
Just to kind of keep ahead of it. If you do have issues, and it depends on the person, what they're going through. Some people I have come once a week for 2 or 3 sessions. Some people come every 2 weeks, and I have one lady that's just a diehard. She wants to come every week, and so she does.
Oh, wow.
She doesn't have a lot of health issues. She just likes to do that over and above a regular massage or any of the other.
If you're on a strong medication or maybe going through a treatment of some sort, would that be a good thing to add in? Like, say you're doing chemo, would lymphatic?
I've had people that would come to me that they may have chemo that morning and come over and do a lymphatic session with me that afternoon or the next day or whatever. And what it's doing, it's not negating the chemo or what it's there for, but it will help get rid of excess toxins from the chemotherapy that might be really dragging you down. And it just kind of helps to flush that out faster so you feel better and can maintain a little bit better.
Would it help with like addicts trying to
like a drug addict, like
or
an
true
alcohol?
detox,
like a detox?
Absolutely.
Detox. Really?
Absolutely. Yes. Yeah. That's one of the things. Alcohol addiction, cocaine addiction, all of those kinds of things are, it's very important to keep that lymph system clean. And as you're going through detox for alcohol or whatever, it's vital to do that kind of work.
It can expedite the detoxification process.
Right.
That's incredible.
Yeah.
And the hair analysis also for people, alcoholism, any kind of addiction, it tells you there are different minerals in the body that are usually pretty depleted in a person that is an alcoholic. And so you want to build those back up, and that also helps with the recovery process.
So I have a question about my sister had thyroid cancer and had her thyroid removed and had, I don't remember, 6 or so lymph nodes removed, like in her neck. And she was just a wreck, like wondering, like, how is my body going to detoxify now? I'm like, you have hundreds of those. So I'm assuming that if you have to have lymph nodes removed for whatever reason, that the other lymph nodes just pick up the burden, I guess, of the ones that were removed. So they just take on the detoxification process.
Right. Well, because you do have approximately 600 lymph nodes in your body. So, you have 20 or 30 removed. You've still got, 500.
So everything just kind of reroutes itself. The fluid just reroutes itself.
Right.
Okay.
Right.
I still don't understand the whole fluid thing.
So from what I understand, I watched a crash course video. The blood and the liquid is kind of leaking through whenever you're giving your cell. Yeah, your capillaries are giving your cells fluid. I think it was 20 liters of fluid is dispersed, 17 liters is reabsorbed, but 3 liters, it's not a super efficient system.
It kind of gets shunted into the lymph system.
3 liters are kind of just not getting reabsorbed, so the lymph system
floating
has to
around there. Yeah. So that's what the spleen, that's part of the job of the spleen, too, is to help with the lymphatic fluid and pulling toxins out of the lymph fluid and then directing it to where it needs to go.
And that's yet another organ that we hear very little about.
I was going to say, I don't know what a
thymus
spleen
gland.
does.
Another one is that you feel it's important for the lymphatic system, but we don't really hear anything about the thymus gland. And by we, I mean, like, it's just
The
not,
general-
generally your doctor doesn't really talk to you about your spleen. There are, I don't know, are there tests to be able to evaluate your spleen's function? Like liver function, kidney function. I mean, we can test those things. Your spleen, I guess, would just be more looking at your white blood cells and lymphocytes and that sort of thing. Okay.
T cells and
interesting. I find it fascinating that we just don't hear much about the lymphatic system at all. And so by not hearing about it, the assumption for a lot of people, myself maybe included, one is that you just kind of forget about that it's even a process, but also that it's not really that important because we're not hearing about it very often.
I feel like this is critically important.
Are your tonsils lymph nodes?
Yes, that's part of the lymph system.
Okay.
Yeah.
And your adenoids too?
So I'm not sure about,
I would assume the
it
adenoids,
is.
but I'm not 100% sure. But the tonsils and adenoids are so closely
That's why,
related.
yeah.
I just hear them getting taken out a lot. And I'm like, why? Is it because could we have just flushed them instead of removed them?
I think that there's especially years, I don't know anymore with kids, but
Like the push to remove them.
The push to remove them. I think that's kind
My
of slowed
kids
down a
luckily
little
have
bit.
never had those problems. So
There are tonsils and adenoids, the gallbladder that can quickly be, pulled out, appendix that is an easy thing to remove. And all of those things are organs that our body needs. And even the appendix, which, I was taught in school that it's just in a little appendage off of your intestines that really has no purpose.
Yeah. What is
but
it?
it does have a purpose.
I think it has something to do with the lymphatic system.
The lymphatic system with keeping your colon clean and housing bacteria, microbes that are supposed to, support the colon cleansing. So all of these are, our traditional medical system is quick to remove them rather than addressing the cause and addressing what the actual problem is. It's just whenever you become symptomatic so much that you can't take it anymore,
Take them out.
and you're doubled over in pain because of your gallbladder or because of your appendix, it's quick to be just removed. And thankfully we can live without them. But I mean, they're there for a reason.
Yeah.
Exactly.
If it's putting your body at risk of not detoxing well in the future, you're causing more problems.
Right.
So physically, you can tell, though. I feel like we might have talked about this, but you're talking about the swollen ankles. Is there anything like in the neck that could be swollen? Okay.
Yeah. A lot of times when there's something brewing in the background, you might have swollen lymph nodes in your neck or, right under your jawline. That's an indicator that, something
Like kind of
isn't-
right behind the ears.
and right
or you
behind
have a
the
bunch of
ears.
those.
Yeah.
You know what I just realized? And I don't know, maybe I'm imagining this, but for years I have had a click when I swallow and I've gotten my thyroid, everything's looking fine. But I don't think I've had it since I got the lymphatic drainage.
Oh.
I don't know if that's related or maybe it just happened sometime near the same time, but would that have something to do? It was right when I swallowed, it would click. Are your lymph nodes
You've
right
got
behind your throat?
You've got lymphatics and that's where you always start. Well, I always start in the subclavian vein right below the clavicles. That's the main drainage terminal for your lymphatic system. So I always start there, opening that up. And then the next place that I go in the treatment is in the neck area behind the ear, on both sides and up underneath your chin, because that's all lymphatic and that's a lot of lymph nodes and glands and things. So you want to open all of that up to begin with. So that could be, thank you very much. I'm
going to keep an eye out for my click.
Yeah.
So that's where it kind of, I know you have some in your face, but they're mainly here. That's where it starts.
Yeah.
And then it just goes down.
Yes.
Does it come back up?
All the way down to the bottom to your feet and back up.
Just stays in your feet. Just stays in your feet.
Well, you eventually pee it out or something.
Yes,
because I remember.
Well, and after the treatment, you probably will pee more, and because it's going into your waist, and so for the next day or two, you might notice that your run into the bathroom more often.
Yeah.
The lymph goes to the intestines, and then it goes to the pancreas and the liver, and then to the brain. So that's why that all of those systems are very important in keeping this all clean and toxin free as much as you can.
With the liver being, I don't know if clogged is the right word, but not working efficient, your liver performs like 500 jobs or something. So all of your medications, all of your supplements, or the vast majority of medications and supplements have to be filtered through the liver. So if you're over supplemented or over medicated, or even just medicated, like 70% of the population, that has to go through your liver and process all of that, in addition to the foods that it processes or the food chemicals, I would say. So if your liver is a part of the lymphatic system and your liver is sluggish, then it's obviously going to play a big part in the way that your lymph can flow and move through your body. Also, I'm remembering now that, for a while, and I don't hear this as much anymore, but the reason that underwire bras were not recommended is because it
cuts off the lymphatic
stops
flow.
the lymphatic system around your breast. And so I don't know if they can say that causes breast cancer, but certainly not removing the toxins in that area can.
It's been suspicious. Yeah. It's always been a question.
Yeah.
And we can't sit here and go, oh yeah, that's what, but it is, it's a question.
It's reasonable to think that to make it questionable, that if you're not removing the toxins around your breast, that they are going to hang out there and create potentially more challenges, along with, other genetic challenges and things like that. But you have to be able to move those toxins through.
Yeah, exactly.
Is it just the pressure, or is it the metal? I guess it's the pressure.
It's the pressure. It's just cutting off the flow, the lymphatic flow. It's binding and squeezing and cutting it off.
Well, I guess I need a new bra.
I was going to say, I have visions of taking off my bra and then jumping up and down on the reformer, just to get it all out
for the day. Yeah. Well, whoever invented the bra was evil anyway. So that's a whole different topic.
Agreed. Absolutely agreed.
So, I doubt it was a female.
I was telling my kids this the other day. I was like, a man invented the bra. And my daughter was like, how do you know that? I was like, only a man would do this.
Exactly.
So,
yeah.
So tell us a little bit how you would use results from a hair analysis in conjunction with potentially clogged lymph to be able to support the lymph system.
The hair analysis will just show you so many things that are going on in your body.
So it's looking for mineral deficiencies.
Mineral deficiencies, or too much of something or not enough of something, and so it shows you kind of what's going on in a person's system. It guides you towards changing some of the things that you're doing, or some of the vitamins. People will come in, they'll have 4 Walmart bags full of supplements that they're taking. And so, I go through those with them and talk about each one and why are you taking this, and, what is this about, and try to eliminate them. And what I try to do with the hair analysis is keep it as simple as you can. It's not about adding a whole bunch of bottles of things to take. It's about simplifying and really cutting down on how much you're putting in your system because of the liver, the lymphatic system. You're taxing all of your organs when you're shoving pills and supplements in your mouth all day, every day. There's a lab in Dallas that I use, and they take just a little, about an ounce of your hair and test all of the minerals that your body makes, and send a report. It's a written report that shows all of these things, everything from calcium, magnesium, sodium, potassium, iron, lithium. It tests lithium levels. And so people with like bipolar, if they're low in lithium, you can start them on organic lithium that is not a chemical out of a lab. It's an organic lithium mineral that can help kind of take the edge off of that and kind of balance that whole process. So there are different things that you're looking for when you do a hair analysis.
So if someone has a deficiency in something, I'm making the assumption that you would encourage the foods that have that mineral in them first, as a way to replenish that deficiency.
Yes.
And then look at other minerals that would be like the counterbalance, like copper and zinc counterbalance. So if you're taking a lot of zinc and have really high zinc, then it can lower your copper.
Right.
So looking at where they might have those imbalances based on other minerals.
Exactly.
Does it also show heavy metal, like toxicity?
Yes, it does. Like cadmium, lead, arsenic, different things, mercury, aluminum. That's one that, if a person comes in and they have a history in their family of Alzheimer's, the first thing you want to look at is the aluminum level. And a lot of times they will have higher levels of aluminum. So you start doing things, eliminating aluminum out of their household, and everything from aluminum pots and pans to drinking sodas out of aluminum cans to deodorants that have aluminum in them.
There goes the Magnolite pot.
I know, that was the most heartbreaking thing.
That's been
what?
Yeah.
Magnolite pots made of aluminum.
In this area of the country, that's been the biggie. You're heating the food, and the food's absorbing the aluminum, and then you're ingesting that in your system. So, and I love Magnolite too. I think they're great.
But cast iron's also great.
It's good for iron.
It's
good for your iron, though. That's a good one.
Yeah.
Okay.
Then,
I was like, okay.
if you're prone to anemia, you would want to use a iron pots and pans. But there again, occasionally I'll have somebody that has real high levels of iron, and they so that's it's always like, take that iron skillet out. I know it was your grandmother's, but
people don't think about that. They think about the food, but they don't think about the vessel in which the food is cooked, and you're heating it up just like you wouldn't. You don't want to microwave plastic. It's the same thing.
Yeah.
That goes back to our detox systems. Our bodies are designed to detox those things. If we don't overwhelm the system.
Right.
So if you don't cook every single meal in a Magnolite, you're probably going to be okay. I'll still have conventional produce sometimes if I can't try to stay away from the conventional strawberries if I can. Yeah. But there's certain foods that a little bit isn't going to kill you, immediately. Yeah. So
we don't really live in a culture where we can have everything organic.
Exactly.
We just don't.
Yeah. It would be very expensive and very hard to source those things.
Right.
Yeah.
So, conventional produce, I eat conventional produce.
Yeah.
It's just what what I have to do.
You heard it here first, folks.
You
the
heard
dietitian eats conventional produce.
That's right.
Yeah. But I think, I think moderation in anything is the name of the game.
Right.
You just have to be mindful of.
And I think across everybody who's come, the biggest thing is learn what you're deficient in, learn what you have excess of, and then go from there.
Yes.
Because that's the only way you can really know what the problem is.
Yeah. Exactly.
Yeah, I think we get hung up on a lot when it might not be a problem for you individually, because we're also bio-individual. Not every single person has all the same problems or has the same effects from whatever the thing is. So how do you see this health landscape? How has it changed in 35 years?
There's a lot more openness about it. There's a lot more acceptance of holistic health. People are better educated about it now. When I first started, and I would say I was a naturopath, people would look at me like I had a horn growing out the top of my head,
I can believe that.
And and it's not so much that way anymore. So, I think it is more accepted, and people are tired of taking prescription drugs all the time. Every time you walk in a doctor's office, they're writing a prescription and shoving it in your hand, and
just looking for other options. People, I think, are now kind of awakening to the fact that there are other options. Where for so long we didn't realize that there was another option.
Exactly.
Well, I think there was a big campaign against anything natural and alternative for a long time to vilify it, so that don't even look at them. They're crazy witch doctors, just
quacks.
Focus on the
Everybody, they're quacks.
Right.
Yeah. And there's still some of that. You can look on the internet and find all kinds of, scary stories and things.
Right.
You know,
And I'm sure there are some,
and there are
quacks.
some. Yes, there are.
But a lot of what the OG quacks were saying is coming to fruition, and people are starting to realize it.
Uh-huh.
So do you have a facility?
Right now, I'm working out of my home.
Okay.
I have an
In
office
Lafayette?
at home. Uh-huh.
Okay, cool.
Yeah. I've had an office before, and my clients liked my home, and they loved my cat, and they were always like, "Oh, I miss Fred. I wish you were back at home." And so occasionally I'll step out and go into an office situation, and I always come back home. So it just works, and they're all happy, and they feel comfortable there, and all of that. So
on one of our recent episodes, we were talking about how the medical system isn't comfortable. You go into an office and you just kind of feel sterile. And whenever you're in a home, cozy environment, it doesn't have to be a home, but somewhere where you feel comfortable. I think you let your guard down, and healing can happen when you feel
more open.
Your nervous system is less, especially if there's a cat around.
Yeah.
That's helpful.
Yeah. Unless they're allergic to cats.
I was about to say, unless you're like me.
We'll meet in the garage.
But yeah, I have the cat and a big dog to greet you at the door when you walk in.
Nice.
But it's I think it's a lot easier environment for people to be able to let their guard down and be comfortable, and then you're able to establish that trust and rapport with people quicker, I think, than in a sterile office atmosphere.
Right. So how can people find you if they're looking and we want to do some kind of light therapy or hair mineral analysis? What would be the best way for people to find you?
I'm in the process of putting a website together, drbetsy.net. That's the website.
So that's how people should reach out to you, is drbetsy.net.
Is there like an assessment you do first, or they just come and you...
They come and we sit and talk for a while. I spend some time with them and kind of get a feel for what's going on with them. Well, I spend about 30 minutes probably with each new person to kind of get a feel for what's going on in their lives and why are they here, and I have a form to fill out, get an idea of what's going on with them, and then that way I can kind of guide them into I call it empowering people in their wellness journey, just kind of help them look at some things that they might want to do on their own or with me, the lymphatic work and the hair analysis. I do homeopathic remedies and different things like that to just kind of help facilitate whatever they're going through.
So you're giving them a look from a totally different lens than what they normally would get in their traditional medicine.
Exactly. And I am probably different than a lot of people in that I do encourage them to stay with their medical doctors. And especially if it's, like a heart condition or something like that, or, thyroid, diabetes or whatever, you need an endocrinologist on board for that. You need a cardiologist for that. I'm happy to work with you in your journey and do sideline holistic treatments and things. But as far as I've never been one to pull people away from, don't go to him anymore.
Right. Do you work in collaboration with doctors, or is it just kind of through the patient?
Yeah, I have in the past.
And are you well received in that?
Yes,
scene?
I have been. Yeah.
Good.
Yeah. I've had some very fortunate experiences with doctors that were interested in what I did, and they were open to what I did. And I've had a couple of doctors call me in the past. I had a very well-known neurologist here in Lafayette that called one time, wanted to know what I was doing with 3 of his patients. He said, I'm releasing them because I can't do anything with them. And whatever you're doing is
wow, that's wonderful to hear.
And
yeah,
so
that's great.
that was exciting. That was real exciting.
And I think that also proves your credibility if you're not trying to get them away from the system, because there is a place
There's a place for both
all of
sides
it.
of the fence. Yes. Yeah.
Yeah, the more that we can collaborate as a healthcare team around someone, the more likely they are to be able to heal themselves.
Right.
Yeah, I think the silo thing is one of the biggest problems that we have in healthcare right now. And providers starting to communicate better with each other, that's only going to help the patients.
Exactly.
Are there any negative side effects to this process?
The only thing that sometimes people might feel tired if they have a real issue going on, if they're really into the depths of something that's happening to them, they might feel sluggish the next day. They might feel a little nauseated. They may not feel quite up to par the next day or two because they are detoxing a lot of toxins that have built up in their system that's creating whatever it is they're dealing with. So they might, for a day or two, and then after that, they're like the experience that you had. They feel lighter. They feel better.
Mm-hmm. So there's no interaction with medications or any contraindications for either medications or particular diagnoses where you'd say, no, it's probably not a good idea.
Yeah. What about devices? Like if someone has a pacemaker or something like that? A
pacemaker, I would be a little more cautious with. Probably not work. I have worked with pacemakers in the past, but there again, it depends on the person.
And there are other ways to do it than the light therapy.
Exactly. So you can do I can work with people that have had a pacemaker and do something totally different than the light therapy.
So I'm just thinking about this. What are the similarities between light therapy and saunas? Like doing an infrared sauna. Is there are those similar in any kind of way? I'm just thinking because it's an infrared light, so it's not not right on the skin like what you're describing, but you get the infrared light.
I have a machine that is a far infrared light that I use in conjunction with this. The far infrared I use on people with joint aches and pains and things like that. While I'm doing the lymphatic treatment, I'll use it on certain things that are going on with them if they've had surgery and it's healing or whatever, joint issues, the knees, the swollen knees, that we talked about earlier. Things like that,
Well, before we let you go, we ask all of our guests one very important question. What does living vividly mean to you?
And I love that question. Living vividly. It's waking up in the morning in prayer and gratitude for a new day. It's looking for the greatness that might happen that day. It's being thankful for still having a passion for what I do after 35 years of doing this. It's having no regrets in my life. And I tell my clients, and my friends, have no regrets. Jump out of the plane, be a balloon runner in the Macy's Thanksgiving parade, which is what I've done 3 times, and it was great. And I highly recommend that to anybody. Jump off the cliff into the Merced River, stand under a waterfall in Yosemite. Anything that you have a passion to do it. And just live life out loud. That's what living vividly is to me.
Yeah, I love that.
The best.
And always remember that everyone is beautiful.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.